where I will ask my colleagues to support approval of my resolution declaring the City Council's support for State Proposition 1. Mental health, addiction, and homelessness are some of the most pressing issues facing San Diegans and all of California, and our families and friends and neighbors during their times of need are being told that there are no places to go get them into treatment so they can bridge back to their lives. Our social workers, our law enforcement, our nurses, outreach officers, behavioral health workers are telling us, in fact, they're begging us to do something about this, because the patients must wait weeks, months, and some even years to get the proper treatment they deserve. Our lack of behavioral health resources is a tragedy. It's plain and simple. Our distressing status quo stems from decades of stigma, fear, and unaccountability. And it's time we do something to change this, and not just a half measure. That's where Proposition 1 comes in. Prop 1 is a two-pronged proposition on the March primary ballot, and it directs $6.4 billion of existing funding to build 11,000 mental health inpatient treatment beds and 27,000 outpatient beds. That's right, this major investment in behavioral health that we need, and we needed years ago, it's coming on Prop 1, and it doesn't have a single cent increased in Californians' taxes. That money exists now. Prop 1 directs it to go to this problem. Prop 1 provides funding for behavioral health, it reforms outdated mental health laws, and it demands accountability for how the taxpayer money is spent. And the bond measure would direct funding to our most critical needs. It would be the largest expansion in state history for behavioral health treatment in residential settings. Prop 1 reforms very specifically the Mental Health Services Act, which hasn't been reformed since it was created 20 years ago, and it funds 30% of the state's mental health system. Prop 1 would expand the Mental Health Services Act scope, so in order to do things like, finally, include substance use disorders. It would provide ongoing resources for housing and workforce development, and investing for the long haul in prevention, early intervention, and pilot programs. In fact, passing Prop 1 saves us money in the long term, because doing nothing, which we've been doing for a long time, is far more expensive. Prop 1 directs $1 billion to help veterans who are experiencing homelessness, mental health and substance abuse issues. Prop 1 would also establish a new annual county behavioral health outcomes accountability and transparency report to provide public visibility into the county's results, the disparities and the spending, and the longitudinal impact on homelessness over time. This proposition addresses the issues that we are facing today in our city and in our region and in our state: mental health, substance use, and homelessness. Prop 1 is key. In fact, I would say it is the key to providing funding and legislative reform to this crucial issue that our region is facing. Now I'll turn it over to Dr. Michael Plopper, psychiatrist and former chief medical officer of Sharp Mesa Vista Hospital, to give more context on the potential positive impacts of Prop 1 and the need for behavioral health reform.
Thank you, Councilman Campillo. I'm Mike Plopper. I formerly was a chief medical officer at Sharp Behavioral Health Services, and that includes Sharp Mesa Vista Hospital as well as Sharp Grossmont Hospital. And I've been a psychiatrist in the community for 40 years, so I do know the needs of the severely mentally ill in this community. And we are facing a crisis. It's obvious that when we witness the homelessness epidemic in terms of the critical nature of our issues today, but also what happens in our hospitals. It's somewhat less obvious to the public. We are having huge issues trying to transfer people out of our hospitals and into the community. And the reason is we just don't have adequate residential treatment services available in the community. And this has been true for quite some time, and it just gets worse. Last year in San Diego County, we delivered over 17,000 inpatient psychiatric days to people who had finished their treatment but were sitting in our psychiatric hospitals waiting for placement. And you can imagine being in a psychiatric hospital is designed to have an average length of stay of 8 or 10 days, and you're staying there months as your co-patients are discharged into the community. You aren't, as you're waiting for placement. So it's dispiriting for people, it's inhumane for people, and we need to do something. We are absolutely at a critical juncture at this point. Prop 1 does address these issues. It does increase residential treatment capability by 10,000 beds. It does improve treatment for the substance abuse issues we have today. It focuses on that additionally. It retools MHSA to directly address our homelessness issue. So it's making it much more focused. It improves accountability. It increases the workforce. There are a number of ways in which Prop 1 can positively impact our situation today. But it'll be a long haul. This isn't the only thing we can do to make things better. There will be a number of efforts that are going to be necessary, but this one is absolutely necessary to be able to move us forward because we're stuck today. And this is, so please, this is an extremely important issue which impacts our community directly, and we have a way out. So thank you very much. Thank you, Councilman Campillo, for leading the charge.
Thank you, Doctor. I'll now introduce Crystal Robbins, Program Manager for the LIFT program at the city. Crystal.
Thank you, Councilmember Campillo. Good morning. My name is Crystal Robbins, and I'm the Program Manager for the City of San Diego's Life-Saving Interventions for Treatment, or LIFT program. The LIFT program is housed with San Diego Fire Rescue and works directly with their Resource Access Program, San Diego Police Department's Neighborhood Policing Unit, and Homelessness Strategies and Solutions. The mission of LIFT is twofold. First, our team works to identify service pathways and appropriate levels of care for the city's most vulnerable individuals who are cycling from the streets, hospitals, and sometimes jails. Secondly, our efforts are focused on reducing the overutilization of 911 for those who may be frequently activating emergency services to meet their basic needs or as a result of chronic mental health or substance and alcohol use disorder. Our program works with some of the most critical cases in the city, which are referred to us through our partnerships with city first responders and outreach. LIFT and other programs like it are imperative to connecting these high-need individuals to vital resources. We've learned through experience that it takes a diverse, multidisciplinary approach to successfully advocate for these patients. So we have developed rapport not only with the stakeholder agencies, but also directly with the patient. Prop 1 has the potential to open imperative behavioral health care access to those who need it most. And Prop 1 can support programs like LIFT, which will enhance the new behavioral health system and bridge implementation of upcoming legislation. Our hope is that Prop 1 will support the dawning of a new, higher standard of care for those unhoused with mental health and substance use disorders. We stand in support of Prop 1, the Behavioral Health Services Program and Bond Measure, and thank Councilmember Campillo for declaring the behavioral health bed crisis and supporting Prop 1 as well. Thank you.
Thank you very much, Crystal. Last month, the San Diego City Council unanimously passed my resolution to declare a behavioral health bed crisis in the city. We acknowledge this crisis and the toll it is taking on our region, and we see the consequences of an outdated and underfunded behavioral health system. And as we work as a city to prioritize homelessness prevention, we must look at all angles of this issue. Providing better and more accessible treatment to those experiencing mental illness, substance use disorder, and more is an incredibly important piece of addressing our homelessness crisis. Not only are these issues sometimes the cause of someone's homelessness, often those experiencing homelessness are forced into environments that trigger mental health and substance use issues, stunting their ability to return to normal life. More resources must be provided, and there must be accountability attached to it. San Diegans deserve dignified care. These are our friends and family and neighbors we're talking about, homeless and housed, going through some of the worst moments of their life. Some things that most of us can't even imagine. So failing to provide adequate treatment for these folks is unbecoming of a just and caring society. We must do better, and Prop 1 will get us on track to far better. That's why I'm asking my colleagues to stand with me, the behavioral health leaders, law enforcement personnel, first responders, and those who simply care to take care of those who are suffering so much. to support Prop 1. We must seek reform, we must seek solutions, and as the county investigates ways to expand our region's bed capacity, I ask the county to also formally support Prop 1. This is an opportunity to show that San Diego is united in combating this crisis that's affecting so many. Thank you, and thanks to those who came to support this today, and we'll be happy to take one-on-one interviews at this time. Thank you.